Welcome, ladies and gentlemen. The topic of today's discussion is pleomorphic adenoma, salivary gland. Um, this is a benign tumor of salivary glands, which most commonly involves the parotid gland. Now, you remember there are major salivary glands, minor salivary glands. The most prominent ones are the parotid and submandibular glands and the submental glands, and then there are minor salivary glands inside the oral cavity. Now, this tumor, a benign tumor, most commonly involves the parotid gland. Now, you remember the location of the parotid gland, just below the if when it presents a bit just below the ear, right or left, it may be any one. Now, generally the patients are going to tell you that so their swelling appeared about 2 months ago or 3 months ago, so that tells you that it's slowly growing swelling. And generally, when anything that doesn't cause any pain to the patient, there are a lot of patients who are going to neglect it. So it's a painless, slowly growing mass, which presents as a nodule in the area of parotid gland. Now, you know that how it presents clinically. Generally, there is no associated fever or anything else. It's just swelling or kind of a nodule in the area of parotid. On gross inspection, we'll shortly see how it looks like, but remember that even if it's a benign thing, it may be encapsulated or may not be encapsulated, but most of the cases are encapsulated. But they are well demarcated, and they are well demarcated from the surrounding normal salivary gland tissue. We'll see it on the histology as well, how well demarcated it usually is. On gross inspection, when the specimen is received, it's kind of a gray-white cut surface. Okay, now this is how it looks like. If we describe the specimen, that this is in kind of oval thing, and we know that it's a salivary gland. And here is the lesion, this one and this one. This is the cut surface of that lesion. This is most likely a freshly cut specimen. That's why the typical features we are going to describe may not be visible in this one, but we'll see in the next one. So this is, you can see, it does not appear to infiltrate significantly into the surrounding salivary gland tissue. It's about a rounded thing. This is fresh, so you see a bit of hemorrhage as well, but the features which are appreciable, that it's a discrete mass. It's a rounded mass which is well demarcated from its surroundings. Now, when the tissue gets fixed in formalin, this is how it looks like. This is the typical cut surface. Now, this may be the surrounding fat and normal salivary gland, and this is the tumor we are talking about. You will describe it as, this is a nodule. Again, this is well demarcated. This appears encapsulated as well. Here you can see the capsule, and has got a grayish, typically grayish white cut surface. It kind of appears yellowish here in a fixed specimen, in a photograph here, but the description you're going to get most likely is that it's gray white cut surface with few maybe few bluish hairs. But with my experience, most of the specimens I've seen on gross, they just look white, tan white or gray white. Okay, and if the cartilage like areas are visible, fine, but it's not necessary that cartilage like areas written here are visible. always. So this is the typical presentation. Remember this photograph or this photograph: discrete mass, rounded mass, generally demarcated from its surroundings. This is how it looks like. This is on histology. This is a low power view. Now for a pleomorphic adenoma, the word indicates you a few things. The word pleomorphic, there will be different elements involved. So there are these three elements which are generally seen in a pleomorphic adenoma of salivary gland. Epithelial elements, and with epithelial, we use the word here epithelial elements because there are different structures these epithelial cells may form. They may form tubules, they may form acini, and then there are myoepithelial cells which generally surround these epithelial cells, and there is a loose myxoid background. Try to remember the word myxoid background, which may contain islands of cartilage or chondrocyte-like cells. Okay, now this is a low power view, and you can see here in the surroundings that this is the normal salivary gland, and you can see here that it is very nicely demarcated from the surrounding normal salivary glands. This is the lesion. You can see dark blue areas, you can see light blue areas, so these are the different components, but this is the typical bluish appearance of low power of a pleomorphic adenoma, and this, remember, is the normal surrounding salivary gland tissue. Now if you see a high power of the lesion of this tumor, what you can clearly see is the myxoid or the bluish appearance here in this region, this region, for example, this region. So this is the myxoid stroma we are talking about, and this one and all the ones here, these are forming the epithelial. These are the epithelial elements. Okay, and the fine thin cells, small cells that surround them, are the myoepithelial cells, the ones I'm pointing right now. So at your first look, if somebody gives you a lesion of a salivary gland, to you it looks benign. It's well demarcated. It's it's well demarcated from its surroundings. It's discrete. Does not appear to infiltrate significantly, although there are some rather many pleomorphic adenomas that do infiltrate into the surroundings, and that's why a clear excision margin is necessary for these tumors, and they may recur if a clear margin is not obtained. You'll see the details in your book, but remember, practically speaking, pleomorphic adenomas do recur, and sometimes carcinoma arises in a pleomorphic adenoma, and that is known as carcinoma X pleomorphic adenoma. Okay, now so we have three elements: epithelial elements, which may be in the form of tubules or acini, then myoepithelial cells, and then myxoid bluish substance. Some of these also may be myoepithelial cells, and this is the myxoid blue stroma that forms the third component. Try to remember these three components. Try to remember the gross picture. Try to remember that it's a benign tumor. Try to remember that it can present in minor salivary glands. Remember, for your practical life, it may present in minor salivary glands as well, but most likely it presents in the major salivary gland, and of them most likely in the parotid gland, and then submandibular gland. Okay, and then carcinomas can arise, and the fact that a good resection or excision margin is required, because these can recur as they can kind of make pseudopods into the surrounding normal tissue. So this is it for now. These are the references for today's presentation. Let me know if you have any questions. Thanks a lot.